Hi, my name is Dr. Jane Hendricks, and I want to talk to you a little bit about stem cell therapy. We have seen all the advertisements, all the articles that are coming out, a lot of news about stem cell therapy. It's gaining rapid attention. A lot of clinics are offering it now as a new modality to treat chronic pain, and I'm very excited to be offering it as well. I've been treating autoimmune disease, multiple sclerosis, Lyme disease, Crohn's, and ulcerative colitis, these types of conditions for many years, for about 15 years, and I've been pretty successful with it, with using natural modalities, facilitating immune system, for the immune system to work better. But stem cell therapy, the reason why it's so magical is it's just so powerful, and it works quickly to help a patient get out of pain. With natural methods, when you're using diet and supplements, of course, it works, but it takes time. And obviously, when you do stem cell therapy, I work with my patients to get their lifestyle in order to optimize the stem cell therapy, because you're paying for this. It's a powerful modality, and it is very much optimized by a healthy lifestyle. With that being said, the modality itself is extremely powerful and so safe. The only contraindication mainly is cancer, so it can treat most chronic conditions. Again, some of the ones that I mentioned at the beginning of the video are the ones that I'm focused on. Obviously, what we're seeing most stem cell therapy being used for is osteoarthritis, joint pain, tears, so shoulder, knee, low back, neck, that sort of thing. I do that as well, but I'm really excited about more of the chronic degenerative diseases, and even like post-stroke, so helping stroke victims regain their muscle use and balance, and it's been very good with that as well. Neurological diseases like Parkinson's. And the reason why stem cell therapy is so powerful with the autoimmune and these other things, Crohn's or ulcerative colitis, where there's extensive tissue damage, is that it modulates the immune system through signaling. And we might have heard the term cytokine signaling. It's used in a lot of verbiage when we're talking about stem cells, growth factors, that sort of thing. And you can get growth factors from a number of different types of products, including amnio, which a lot of my colleagues use. Their amnio products are used extensively. The confusion is that amnio is not live stem cells. It has very little or no live stem cells. It has the growth factors, the cytokines, that sort of thing to help the body heal certain areas, and it's great for minor injuries, but we need the big guns, like the systemic stuff, like for the MS or the stroke, the autoimmune diseases. You need the big guns for that, and that's live stem cells, and that's not amnio. So what I'm talking about here is actually live stem cells, and the source that I've chosen is umbilical cord. That's the best choice you want to go with. Actually, it's the only choice in the United States. Embryonic is not allowed. So as far as umbilical cord, a lot of people have been going to Panama to get umbilical cord stem cells because they weren't aware that it was here. There are a couple small labs that do it. One of them doesn't offer the amount of live stem cells that is needed for some of these systemic diseases like MS, because they are mixing it with more growth factors. So again, great for more minor osteoarthritis and injuries, but it doesn't have the amount of stem cells to affect when you have a more chronic degenerative disease and more systemic disease. And so the source that I use is the big guns. You can get 90 million cells. They're all live cells, colony-forming units, which have the potential to differentiate, divide, and of course the growth factors and the cytokines are all there to help stimulate the body's own ability to regenerate the injured tissue. My source is the exclusive provider of stem cells for the U.S. government, and also the Ulcerative Colitis and Crohn's Foundation has endorsed it. And so I'm very excited to be working with this particular lab. Also, unlike the other, again, there's only a couple labs to choose from in the United States. The lab that I use is an AATB, AABB, FDA lab. That's the only lab that offers to doctors that is all three of those regulatory bodies: the American Association of Tissue Bank, the American Association of Blood Bank, and FDA. Some of the couple other labs that are here, again, the smaller ones, one not having too many live stem cells, will be registered with one or two, but not necessarily calling itself a lab with all three regulatory bodies. Also, DMSO is a chemical that's most commonly used in the cryopreservation of the stem cells. The source that I use has patented a process to not have to use DMSO. This is a chemical that is sulfur-containing chemical. A lot of patients, especially with already chronic inflammation, will react to that chemical. So the stem cells that I use are not cryopreserved with that chemical, and actually studies have shown that to not use that chemical in the cryopreservation process increases the survival rate of the stem cells and their viability. So the source that I use also has the highest rate, has the most viable cells when tested against the other labs. They come out the highest, 80%. So most doctors, when they hear that, they're like, really, 80%? Wow, that's crazy. And so maybe it's due to not using a DMSO, but when you're paying for stem cells, you want to get the most amount of stem cells, and you want them to be viable and potent. The other ways to get stem cell, which is more long-standing in the United States, has been adipose and bone marrow. My website, Stem Cell for Life, has that discussion of you could do adipose, you could do bone marrow. It's still being offered widely. In the United States, it has been offered in the past. The umbilical cord is more on the edge of things. It's a new rising source of stem cells. Again, it's been offered abroad, and people will go to Panama to get it, but now it's finally gaining more attention here in the United States that you can get umbilical cord stem cells here. You do not need to go to another country. But in the history, bone marrow and adipose have been choices that a patient has had. The only thing with that is the results are age dependent. So if you're young, if you're a teenager, you're in your 20s, you're athletic, you're healthy, sure, that can be a great option for you because you're going to have a lot of stem cells per aspirate, like the quantity that they get out of you, and they're going to be pretty robust. If you're 30 and older, you might want to start looking at an outside source for your stem cells, especially if you're getting it for an inflammatory disease and not just for like a knee injection. Again, for minor injuries, you can use these other sources, maybe amnio, and just get some growth factors and cytokines. Maybe you don't need to pay the big money for the, the big guns of live stem cells, and you can, save a few bucks and get that. But I just feel bad for patients when they get swept up with all the propaganda and the advertisements thinking that they're getting stem cells when they just got amnio, because there's that confusion out there that in advertisements where they're calling a product stem cells and it's not. Amnio has no living stem cells in it, so it's not even in the same ballpark. Again, that's appropriate for more minor injuries or certain surgical procedures to do that, to repair tissue. But what the kinds of conditions I'm treating, like stroke victims and multiple sclerosis and Lyme disease and autoimmune disease, you need the living stem cells. That's going to give you the greatest result. And after the age of 30, compared to a newborn that has one stem cell per 10,000 cells, a person that's age 30 has one stem cell per 250,000. So way less stem cells, and the ones that you get out of your body are going to be less viable than when you were young and healthy. So it's best to look outside and get the umbilical cord, and then again, choose the right lab. It's always best to choose the lab that's all three regulatory bodies, the AATB, the AABB, and the FDA lab, which is the source that I get mine from. And so if you'd like some more information, go to my website. Stem Cell for Life is my website. It offers a lot of education and research links talking about bone marrow, talking about adipose, talking about the lab, the regulatory bodies and that sort of thing, and then having some research links for certain conditions. And of course, if you are interested in getting stem cell therapy for your condition, we have seminars that you can come to and get more details and talk to me, the treating physician, about your certain situation. We can set up a complimentary one-on-one consultation. If you're not able to make any of the seminars that I have about once a month, every 6 weeks, you can definitely still set up a one-on-one complimentary consultation and say, okay, what's this going to entail for my particular situation? How many cells do I need? How many treatments am I going to need? How much is this going to be? What can I expect? Are there any side effects? That sort of thing. It's a very safe treatment, in-office treatment. That's why I love it, because I've always taken that oath that doctors take first do no harm extremely seriously. I choose modalities that have a really little to no risk. I get stressed out about that. So I choose really gentle modalities, almost to the point of passive, and really stem cells are passive. They're just little baby cells. So what they're going to do is stimulate your own body's ability to heal itself. I've always used modalities, whether it be nutrition or supplements, to work with the body in facilitating the healing of intelligence that's already in there, and stem cells right there along with buying philosophy. It's that philosophy on steroids. It's really, really powerful and yet kind of passive in a way. So I'm really excited to share this in my seminars. Go to stemcellforlife.com. That'll have my phone number if you want to arrange a one-on-one consultation, or feel free to call or email if you have any particular questions.